Now, when I'm talking about students, I'm talking about all learners, but of course I had to complete the alliteration with S, 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 S. But students could be you. It could be faculty. It could be residents. It could be our medical students, whatever learners you are working with. It could be peers, colleagues. But we're going to talk about some strategies to support this stress that we're probably all feeling. I'm Dr. Jessica Seaman, and I am the assistant professor. I am an assistant professor for medical humanities, and I am the assistant dean for faculty development in Creighton School of Medicine. So let's go ahead and get started. And we are going to start with a reflection because we are Creighton University. And I love this thought from Pope Francis about education. And he says it's not only knowing things or taking lessons or taking a class or taking a workshop or listening to a session, but it's about being able to use three lingos: those of the head, the heart, and the hands. So we're learning so that you can actually think about what you feel and do. You can feel about what you think and do, and you can do what you feel and think. And he calls this unity within a person. And I love this reflection. A little bit simpler put, I'm hoping that you can use your head today to learn something new. You can use your heart today to feel something new, maybe make new connections. And you might even use your hands to do an activity. I might ask you to type something in the chat. I might ask you to say something out loud. And activities help us remember. So just remember these three things as you work with learners as well. So I do not have any disclosures, and our path today is to understand what's good about stress. We're going to differentiate the origin and symptoms of stress as it relates to anxiety, depression, and specifically for medical learners and residents. We want to address just very shortly, we are going to address imposter phenomenon, or some people might say imposter syndrome, and that frequently increases stress in learners. So we're just going to touch on that just a little bit, and we want to spend most of our time with the 6 strategies to support learners. So let's get started. We're going to talk about the good, the bad, and cover the strategies. All about stress. Here's the good with stress. You've probably seen this before. There is a stress performance curve. And if you are feeling overstressed, high stress, you are way over on the right side of the bell curve. If you are feeling under stressed, you're way over on the left side. And what we would like, there is some good about having stress because it does something for us. We want that optimal stress, which is right in the middle, that green and yellow. That's the zone that we want learners to be in. That's the zone we want to be in. And why is that? Why do we want a little stress? Well, it gets us up off the couch, right? It might help us be creative. It might help us be productive. It gets us motivated. But if we're overstressed, we can have exhaustion. If we're understressed, we could be totally bored or unmotivated and not get anything done. So don't ever think that we don't want any stress in our learners. Don't think that you don't want any stress in your own life. You just have to make sure it's in the right spot. You want some optimal stress. It can be a positive motivator. If we don't have enough stress in our life, it can keep us from reaching our full potential. And we also talked about how stress can really harm our health as well. And it could be mental and physical health. That's where we don't want to be. And that's what we're really going to be talking about today is the high stressed learner in a healthcare practitioner situation. So those that are learning how to be physicians, that are learning to go out into the healthcare world, usually are on the very high stressed end. And we just want to help them bring that back down to the middle. The good news is that an optimal amount of stress is good and it is okay. But let's talk about the bad just to make sure that we understand that if there's too much stress, it's not good for us. There is a difference between stress and anxiety. You will notice here that there are some things that are similar. So, faster heartbeat can be the same in stress and anxiety, faster breathing, even physical situations like the way our bowels work. But there is something different with stress. You may notice a moodiness. You may notice some anger. You may notice some feelings of being overwhelmed. You may notice this in learners or in yourself. So there is a little bit different symptoms between stress and anxiety. But here's the point. Unmanaged stress, when it is so high into that pink zone on our bell curve, unmanaged stress can lead to chronic stress, meaning it's happening every day. You can't get out of it, and it can lead to anxiety. So some stress is good, optimal amount of stress is good, but if it's unmanaged for a very long period of time, it can lead to other problems. And then you have the differences between anxiety and depression. And in the same way, unmanaged anxiety, if it goes on forever and ever and ever and every day after day after day, it can lead to depression. And it can also lead to self-harm or suicidal thoughts. It is persistent. There is a feeling of helplessness. There is a feeling of guilt and extreme low self-esteem, extreme irritability. So you can see how stress can lead to anxiety, unmanaged anxiety can lead to depression, and so on. So this is why we want to manage stress in a healthy way. Depression is an illness. It is directly impacting the brain. And as we just said before, in extreme cases, this pattern can lead to suicidal thoughts or ideation. So stress, factors that contribute to the onset of depression, we just talked about how that can happen. Hormone levels, difficult life circumstances, genetics, but also stress can lead to that. Now, the next few slides, we're not going to sit on these slides for very long. I just want to bring up the point that imposter phenomenon has been studied since the 1970s. And this seminal paper that came out, the imposter phenomenon in high achieving women, came out in the 1970s. It's the same idea as imposter syndrome. You might use either one of those words for this language, but Doctors Clancy and Imes studied high achieving women in their professional lives and how this imposter phenomenon took place. And the point that I want to make here is that imposter phenomenon, if it is not brought back down to a manageable level, it can increase the stress. And stress can increase anxiety. Anxiety can increase depression. So this is why we also want to be careful with imposter phenomenon. And as you know, it is very prevalent in healthcare practitioner professions, right? So whether it's in medical school, whether it's in residency, whether it's in faculty, it's very common, especially in women. And you will see some of I will just share these slides with you so you will have these references and resources and some of the signs and symptoms, self-sabotage, fear of failure or being discovered that really you shouldn't be doing what it is you're doing in your professional or personal life. And there is no shortage of research. And most of the research does find that imposter phenomenon is more common in women. So it's just important to know it can increase stress and usually more prevalent in women in the studies that they've done. There's some recent studies here, there's some a little bit older studies. And the last thing that I would like to say about imposter phenomenon, it can look different for different people. You might be taking on imposter phenomenon as an expert. You are kind of a know-it-all. You want to make sure everybody thinks that you know everything there is to know. Or it might come in the form as a perfectionist, and you're never completely happy with all the things that you are producing. Any one of these 5 types of imposter phenomenon can lead to more stress. So just know that that is also a part of that unmanaged stress that we may need to address. So I would like to tell you a story. This is a picture of a man named Alex and his family. This was a couple years ago. Alex was in his junior year, about his junior year at ASU. I would like you to get some information about Alex. He was in industrial design. So I realize this is not a healthcare profession, but this was an extremely difficult program to get into. He was also in his 6th year of undergrad and still had another 2 years to go. So his junior and his senior year. And the reason is it does not matter how much schooling he had already accomplished. During the application process, he did realize that he would have to start over with a new 4-year degree if he got into this program. So similar to medical school, doesn't matter what you've already done, doesn't matter how much schooling you've already completed, doesn't matter how many jobs you've already had or what professions you've already accomplished. You still need to do 4 years of med school. And of course, depending on the school that you're going to, but here at Creighton, we do a 4-year medical school. So similarly, he knew it was going to be a lot of schooling by the time he got into this industrial design program. He was also working 25 to 30 hours a week. His company where he was working would love to have him full time. They really, really loved Alex as a worker. Alex loved working at the company where he was at. His wife does work part-time to try to make ends meet with him not having a full-time job. And both parents have very heavy church, and you can see heavy family responsibilities. So I want to ask you the question, what could Alex be feeling each day? Just type it in the chat. You can also call it out if you want to unmute yourself. This could be a one word, it could be a phrase. What could Alex be feeling each day? Okay, overwhelmed, pressure, right? Immense amount of pressure. Anxious. Okay, maybe that stress is actually building into anxiety right now, right? Exhaustion, so tired. Sense of inadequacy. There's our imposter phenomenon. Like, I don't know if I can do this. I don't even know if I should be doing this. Not able to meet all the needs around him. Disconnection. I love all those. Thank you. It's exactly what he was feeling. And then that little guy that you saw in the picture, when he was 6 months old and Alex was still in his junior year, this little guy got sick. They had several doctor visits, lots of medication. He was in the hospital with RSV. One of the parents was always with them. So you can see how that might lead to some of this other anxiety, right? And a lot more pressure, a lot more intense feelings of inadequacy because you just can't be all the places that you need to be. They're not getting a lot of sleep. Baby's not getting a lot of sleep. Older brother's not getting a lot of sleep. Neither of the parents are getting a lot of sleep. The medical bills are piling up. Lots of time away from work. Alex had to miss a little bit of school as well, but he's still trying to stay caught up because this is not a program he can just slip out of and then get back to another semester. He needed to stay with his cohort. And you kind of know what that feels like as you're going with a cohort. I know that we try to have some flexibility. We're going to talk about flexibility in a little bit. But usually you're trying to stay with your cohort. So now I want to ask you, with little baby sick, now what is Alex feeling? And what might he want to do? What do you think are the main things that Alex is thinking? Maybe this would be a better path. You can type it in the chat or you can say it out loud. What do you think Alex might want to do? Quit school, work full time. He already loves the company. It's already something to do with industrial design. The company loves him. They would love to have him full time, right? He can't fix all the problems that are going on right now. And that's exactly what happened. Alex did not want to finish school. Alex wanted to quit. He had already been in a lot of school over a lot of years, and he wanted to be done. He wanted to just work full time. Maybe he could use some PTO to get some work time off and be able to just get baby better, help his wife out. Maybe she wouldn't have to work part time if he was able to work full time. It's exactly what Alex wanted to do. Now, fast forward a few weeks down the road, and little baby is getting better, but still in the hospital. Here's the point. These are real situations. This is a real situation. And these are facing our learners and our residents, even our faculty, all the time. These kind of real life personal situations are coming into the lives of our learners. Now, some are easier than this situation, but some are more difficult. Some are a lot more difficult. Losing loved ones, needing to move to go help parents or to have parents move in with you. There are some long-term situations that can be very difficult. But all of them, whether they're easier than this, about this same level as having a sick baby and being in school for a long time, they all come with a level of stress. So here's what we can't do. So just put these out of your mind. You cannot do any kind of assignments. You can't actually show up and do the work for them. They have to be there in the clinic. They either have to be there at class. They have to do the studying themselves. We can't do that for them. We can't carry learners' loads for them. And we can't take the stress away completely. So what can we do? There are things that we can do to help ease some stress and pressure as we support students and residents in the learning environment. It is our responsibility to learn support strategies. Now, the 6 support strategies that I'm going to share with you are certainly not the only support strategies that you can take on or that you can use in your clinic or classroom, wherever you have learners. But these are the 6 that I have found as a faculty member and also watching other faculty that I have found have been helpful. So let's dive in. 6 support strategies. Here we go. Number 1, give clear expectations. I want to show you a picture. Look at that picture. Read the signs. Enter only. This is not an entrance. Well, this is a picture of right outside of school that I pass by every single day on my way to work. This is real. This is not just something that, is floating out there on the internet. I took this picture because every day when I passed by, I thought, what is going on here? If I was a parent going to this school, I'd be so confused. If I was a student going to this school, I'd be so confused. So let's talk about the why. Why do we need clear expectations? And I know there's a little bit of humor in this, but this really is out there. And guess what? Faculty and physicians, staff sometimes are not giving clear expectations, and they're saying, enter here, but don't come in. It's not an entrance. So why would we need clear expectations? Well, they provide the scaffolding for learners to succeed. It kind of shows them the path forward. What should they be doing? Because most of them, they haven't done this before. It gives some structure to their learning. Clear expectations build trust between you and the learner. And if learners are confused, they get overwhelmed, which the overwhelm is increasing stress, and they really do want to give up, which is what Alex wanted to do, right? And when we have clear expectations, learners are more able to meet their learning goals. We don't need to be so hard and so strict that the goals are not able to be met. So have some clear expectations. Now let's talk about the how, with each of these strategies, we're going to talk about the why. Why do we want to do it? And how are we going to do it? So one of the things you could do is provide a rubric or criteria. Show them the milestones, right? We have the ACGME milestones for every single specialty of how work should be assessed. Now, I have a resident that said to me a few months back, she said, Dr. Seaman, I am in one of the best rotations. And I said, oh my goodness, do you want to do this? Do you want to go into this specialty when you are all done? I'm sorry, it wasn't a resident, it was a student. And I was saying, hey, do you want to go into this specialty as a resident? And she goes, I really don't. But I think it's one of the best rotations because I know exactly what I'm supposed to be doing. They gave me a binder at the beginning of my 4-week, 6-week rotation, whatever rotation she was on. They gave me a binder and it said, who do I contact if I'm going to be late? Who do I contact if I need to be absent or not be showing up to my rotation for whatever reason? Maybe I'm at a conference or maybe I'm sick. It has all the articles that we are going to be doing for Journal Club over the next few weeks. And I already have them in here. And the binder is mine and I can have it and I can write in it and I can use it. Now, this could be something that is like a website. Doesn't have to be a physical binder. I know a lot of our programs here at Creighton do a sway page. Or they do Google Docs, something that somebody can look at, their learners can look at and say, what am I supposed to do for this? So that would be very helpful to set clear expectations. We can also design assessments that really connect to the real world, something that they're really going to see, something that they can relate to, talking about real patient cases, right? And we do a lot of case-based learning within Creighton, but make sure you include things like that. Providing formative feedback. Make sure it's objective. What did you see? What did you hear? Make sure it's specific. Don't cover too many things when you're giving feedback. Just say, when you were talking to the patient, I noticed your eye contact was not, you weren't looking exactly at the patient. You kept looking down a little bit, and that might be confusing to the patient about you talking to them. So make sure that it's specific, something like that, and that it's actionable. What are you going to do with this now? If the eye contact was not good as you were interviewing a patient, then next time I would like to see you lift your eyes up a little bit. And if it's not comfortable looking right in their eyes, maybe look right between their eyes, look right at their nose, maybe look at their forehead, because something right around here in the eye realm could be helpful for a patient to feel like they're making a connection with you. And it needs to be timely. You don't want to say this 4 weeks after you've been noticing that their eye contact is not good. You want to say it right when it's happening. And it can be verbal, it can be written, but make sure that this isn't waiting till a summative evaluation. So, and you're providing obviously a good example of high quality work, right? What does that look like? What does that sound like? So, number two, reflection. I started with a reflection for you today. And here at Creighton, because we are a Catholic Jesuit university, an academic institution, reflection should be a natural part of what we do. And I'm going to give you some ideas of how you can do this because it doesn't have to be exactly the way I did. You don't even have to take that much time to do it. But our Jesuit values encourage the importance of compassion and relationship building and reflection as we work. Ignatius of Loyola taught others through reflection to experience life. And reflection really gives us time to connect with our learners on a more personal level. So that is really helpful. And it creates this trust again between faculty and learner, between trust and learner. And here's different ways we can do this. You might be in a clinic situation all the time. You might not be in a classroom situation where you can put up a quote or you can put up a poem or you can put a scripture on a slide. So what you can do in a clinic situation, you can keep it short and you can keep it simple. And you can say something as your team is gathering together and you're getting ready to go on rounds. You can say, I'd like to start with a reflection. I saw a billboard on the way to work today, and I realized, it said something about I see billboards all the time that are about Christ and doing good for other people. So maybe that's something I want to bring up before we go around to see patients. Just talk about it and just say it out loud. You don't have to have something that's on a slide, a printed handout. It doesn't have to be like that. It shouldn't feel stressful. The other thing that's really great as you start doing this, you're going to start asking learners to provide the reflection. So, and at the beginning, they may say, yeah, I don't feel comfortable doing this, or I don't really have anything right now to reflect on. There's nothing I want to share. There's not anything I want to make a connection to. And that's okay, but you keep asking. And I promise you, within a couple days, they are going to say, hey, I'm prepared today. I've got a reflection. Can I share that? It could even just be some breathing techniques. Maybe you're getting ready to go in to see a difficult patient situation, and all of you on the team just need to do some breathing outside of the door. And you just have them close their eyes, take breaths in, and release the breath, and just have them reflect on how the patient was doing yesterday, how you would like to see the patient move forward, right? There's lots of different ways that you can do reflection. It doesn't have to be something written down like I shared with you today. Now, something that's very important, share your story. I shared a story with you today about Alex. And although you may not remember all the details of the story, you're probably going to remember the name. Even in a few weeks, you're going to go, oh, yeah, Dr. Seaman said something about Alex. Um, and it will help with people's retention. So there was a workshop that was done. I saw this research where they did some storytelling in higher education, and this was done by University of Phoenix. They started getting these workshops together where they would do storytelling to do the teaching, and they found that there was a greater understanding of and empathy for others. So maybe you're thinking, okay, I've had a similar situation to what Alex had, where one of my children was really sick. I was going to school. I didn't know what to do. I needed some assistance. And maybe you have some empathy for that student now. Because I've shared the story, you might have some empathy for Alex, right? Um, the other thing that was organically built was this community of inquiry. People wanted to start asking questions, and that's what we want from learners. If you're sharing a story, and it doesn't have to be your story, Alex's story isn't my story, it's Alex's story, right? And his family story. But there could be some questions that come up because you're sharing a story with them. And they said it also really highlighted career relevance for the learners. So important with healthcare professions, right? Is highlighting the relevance of what it is they're learning about and how important that is. So case-based learning and doing things together as a team, thinking about a story or thinking about a case with a patient is really going to help them reach that depth and understanding and relevance for a career. Now, I will tell you that Alex, this is a picture of Alex and his family just a couple months ago, because the story that I shared with you previously was a couple years ago, and Alex graduated from his undergrad finally at the end of May from ASU, and this is his family at graduation. One thing I will tell you is that Alex is married to my daughter Madison. So this is Maddie, and these are their children. And Alex is my son-in-law. The way that you can share a story, it can be your own personal story. This isn't my personal story, but I got permission from Alex and Maddie to share this story with you. And I'm closely related to this story, so I could feel some of the angst and some of the anxiety and some of the pain that they were going through. And it was hard to watch them go through some of that. But what you can do, you can teach a whole entire course or rotation. Maybe you only see the learner for a couple weeks. Maybe you only see the learner for 4 weeks. And you can teach a story as a narrative arc. You can teach the rotation with a story as a narrative arc. So what you're doing is maybe you only have them for 2 weeks. Let's say you have some learners for 2 weeks, and you start maybe on a Monday, just giving them a little bit of information. Maybe I just say a little something about Alex and he's going through this hard time. And maybe on Tuesday and Wednesday, I say a little something about his child who is in the hospital because it is related to maybe something that we're working on with a rotation. And then maybe by Thursday, Friday, I give a little bit more information about the story. And then the next week, hey, remember Alex and the story I told you about Alex? Well, I want to tell you the good news that he graduated, and there's good things happening for him right now. A narrative arc is going to cover the entire rotation, or it's going to cover the whole entire course. You might have a year-long course with them. You might have an SIS that you're teaching with them within the gold track, and it's something you're going to teach over 8 weeks. So you can connect the dots along the way. And there's some really great research about using storytelling as a narrative arc, or you can weave one story into one session. like I'm doing right now today. I'm talking about Alex and the beginning of his story, and I'm going to also share some ending of his story. Um, and his next paths in just a little bit, and that's going to be in one session. So you can choose how you would like to do that. You can choose what's comfortable, but just remember, storytelling is so important for retention. It helps learners retain things, and it helps build a trust and connection with the learner that's in front of you. Now, the story about Alex, it really is just the beginning. It's not the ending. This is their little guy just last week, just last Friday night. Had a little visit from the paramedics. They had to call 911. There, I know it, you can't see it right now, but man, head wounds bleed, right? And there was blood everywhere. He needed to get some stitches. So it the story can go on and on. It's something that you can tell a little bit more pieces as you go along, but everybody's story keeps continuing. It's not um, it's not the ending of the story, but just remember that with storytelling, you want to share something that you either know something about, that you've had an experience with a patient. Maybe it's your own personal story. Maybe it's somebody else's story that you've had permission to share with them. Um, but storytelling is important. Number 4, use humor. We've done a little bit of that along the way here. So here's a question. Why is a doctor always calm? Well, they have a lot of patience. Use this one with your learners next time, right? Next time you see them, they're just going to love it. They're going to think you're great. Using humor. Why do we want to do that? Retention is higher. Research shows that retention is higher when you use some humor. It can reduce stress and anxiety in whatever is going on. It might be a very difficult situation. You might be in an OR. You might be in an emergency room situation. It does increase self-motivation for learners. They may want to come back to your lecture. They may be really excited about coming back the next day because you're using some humor with them. And it creates a positive social and emotional learning environment. How can we do this? You can tell lighthearted personal examples. It could be part of the storytelling, right? You can weave some humor into the storytelling. You can just tell a simple joke, like I just shared with you on the last couple slides. You could start rounds with a funny story. But here's the deal with the how. And I know this is going to be difficult with healthcare professionals, but keep it appropriate, keep it clean. Don't use gallows humor. You don't need to be crude. You don't need to be vulgar to be funny. In fact, the respect and the trust can actually be more solidified if you are not being disrespectful about a patient, being disrespectful about the body, being vulgar or crude. The connection and trust can actually be more solidified with learners if you are respectful. So don't be crude, don't be vulgar, keep it appropriate, keep it clean. I know some of you are rolling your eyes, and that's okay. But try it. Just try some funny, maybe dad jokes, those are good ones. Number 5, be flexible. Why do we want to be flexible? Because we all have an Alex in our learning spaces. You may even have more than one Alex in your learning space. Now, this is Alex and Maddie's family just a couple weeks ago. They brought a new baby into the world, and doesn't mean life is all good, right? Because a week later, the little guy split open his head and they were back to the emergency room. Doesn't mean everything is, roses and poppies and running through a meadow. But when our learners are struggling, we've got to be flexible. And we all have an Alex in our learning space. We want to be flexible because it helps learners feel more engaged and it helps them feel understood. It can lead to better academic outcomes. I want to tell you about maybe I'm going to do it on the next slide, but I do want to tell you about a flexible situation that I was needing the flexibility. So let's just read this last one. Rigidity can actually create more stress. So that's not good for our learners either if we're being so strict. And I know you have a lot of learners, right? So when I'm teaching a class, I've got 120 learners in one class, got another 120 learners in another class when I'm teaching medical humanities. And I know it would be difficult to be flexible with 50 of them, right? About turning in assignments or about um, participating or things like that that they need to get done and the things that they need to do. I know it'd be hard to be flexible on a large scale, but once in a while we can be flexible. And how can we do this? One of the things I want to tell you, I just finished my certificate, my graduate certificate in leadership and well-being in July. And during this time, my mom had moved into our house. So we were packing up my office. We were going to move her into the office so she had her own room. Well, I'm in the middle of an 8-week class and I started getting behind. My mom was moving in. We were trying to pack up things. We were trying to figure out a lot of things. I also had a faculty conference that I was going to. I had just presented at a couple national conferences the month before. Life was crazy. But I reached out to my instructor here at Creighton and I said, listen, life is nuts right now. Here's what's going on. I'm wondering if I can have a couple extra days on this very large project that was coming through. Now, the reason she was able to be flexible is because I wasn't asking for that all 7, 8 weeks, right? I was asking for it one time. So learners have to understand that flexibility is kind of a two-way street as well. They can't be asking for it all the time. And that's not fair for you, for them to always be asking for flexibility. But because I had been doing my work, been doing my job, been doing it well for many weeks, then when I did ask for the flexibility, she was more than happy to extend that to me. And I want you to think for just a minute, how are you flexible with learners? Type something in the chat or unmute yourself and share with us. How are you flexible with learners? Hey, different kind of projects. Good. Thank you, Terry. Oops. Sorry about that. Extension with due dates of assignments, just like the story I just shared with you. Good. Thank you, Joanne. Who else? Anything else? What about those in the clinic? What kind of flexibility are you extending to learners in a clinic or hospital situation? Do you give them your cell phone number if something is coming up and they need to reach out to you? Have others on the team take over some of their clinical assignments. Okay, great. So maybe they're still coming, but maybe they're not able to get to all the patients that they need to see that day, and somebody else can take a couple patients for them. Absolutely. Pairing learners with preceptors who have similar backgrounds and experiences. Great. I love all these ideas. Nice. Now, I know number 6 is a little bit related to flexibility, but we're going to talk about a few different things with compassion. Compassion is another way, and this is the last one we're going to talk about. But compassion obviously is mission driven with Creighton University, and it actually says in the Division of Student Life that we want to produce learners engaged in their communities with compassion, not just engaged, but engaged with compassion, with confidence and character. We have that in our mission, in our vision. We want this of our learners. So we need to share that with them and say, this is what's important to Creighton, and this is why you're here, is that you're now going to take compassion out into the world. I love this quote by Ralph Waldo Emerson. I used to teach at Ralph Waldo Emerson Elementary in my neighborhood school. I taught there for many years. And so he just has a place in my heart. But I love what he said about the purpose of life. He said, it is not to be happy, but it is to be useful, to be honorable, to be compassionate, to have it make some difference that you have lived and lived well. If you are compassionate, it's going to make a difference for learners. The other why is it strengthens the connection between you and the learner. Whether you are faculty or staff, compassion is important. I want you to think for a little bit. What have you done just over the last couple of weeks to show compassion with a learner? What have you done? Type it in, or you can unmute. One of the things that I've done is just sat and listened. Just listen. Let them say what they need to say. Let them get it out. Sometimes they come to their own answer, right? By just talking things out. Okay, we've got a few here. Okay, giving them hugs. You always want to ask, right? Can I give you a hug? But giving hugs when appropriate, you bet. And what else did we see? Ask them how their week went. How was the weekend? How was your week? How was yesterday? How was last night? I know there was some struggles at with some personal situations. How did that turn out? Asking them questions, you bet. Show them that you care about them outside of the job. So asking maybe not too personal of questions, but if they're willing to share, ask them about maybe their siblings or their family or how they grew up or where they grew up and what that looked like for them. You bet. Excellent. Good ideas. So showing compassion, super important. Now, the next few slides are going to be resources for you, but have a plan with compassion. At Creighton, we have a plan. And I know this is not exactly the student life is usually for undergrad. And so this maybe isn't seen by all of you for graduate students or for residents, so for your colleagues or peers. If they are residents or faculty or colleagues that you're working with, we have the EAP system, so the Employee Assistance Program, and they're able to go through that way if they need more compassion and need more assistance. But this idea of, time and energy commitment increasing with students, but also a level of student autonomy. The autonomy being low over here on the right side and autonomy being very high over here on the left. We have a step level within Creighton University. It's the flexible care hybrid model, and these are the pathways. You can use this same pathway with your colleagues, with your peers, with your learners. You can say, hey, maybe we're to the point where you might need some individual therapy. That compassion can be shown by just saying it out loud to them. And obviously the autonomy gets lower and lower as you get up to that point of individual therapy, but maybe you can sit and help them make that first call or be with them on the first virtual visit as they are receiving some of that. These are just some ideas of how you might be able to show some compassion. And for screening, yes, they do official screenings within Creighton with the undergrad, but guess what? We can screen by asking questions. We can ask questions of them. So, and one of you mentioned asking them about how things are going is really an important start right here, right? So I wanted to share that with you. And then I love Dr. Ornish. He is all about health and taking care of yourself and eating well. And I love what he says about this. And keep this in mind: health, wellness, and peace are things we already have inside of us. We don't have to get them. We don't have to reach out for them. We can teach learners that you already have it inside of you, but we have to stop disturbing them. And I love that. Sometimes faculty, sometimes staff, we can be the disturber of someone's peace. And I know you have a job to do, but let's not be that disturber of, let's not get in the way of the right amount of stress that a learner needs. So they already have some health and wellness and peace. They already have that inside of them. Let's teach them that they already have it there, and let's help them access that by helping them reduce their stress. I've got some other references for you here. They're hyperlinked. You can just click right on those links. And here's how you can reach out to me. Different ways that you can reach out, different things that we do here in all of the health sciences. We have a YouTube channel. You can find videos and other helps on that YouTube channel. But here's ways that you can get a hold of me if you have any questions or would like me to flesh this out, maybe within your program, and we can do a little something more. Now, this is the survey without CE. So if you don't need the CE credit, maybe you're a resident, you don't need the CE credit. Maybe you're a student, you don't need the CE credit. Just take a snapshot of this. It will take you right to the survey. And then Sheree has been sharing the activity code with you and the CME tracker if you do need that. We've got just a couple minutes right now. If anyone has any questions, you will be able to receive the slides and the recording within the week so that you can get back to some of these references. But I hope that if you have a student, a learner, a resident that is, you can tell, in a very, very high stress situation, and maybe the anger is coming out, the overwhelm is coming out, the moodiness is coming out, I hope that you can use one of these 6 strategies that we talked about today. I hope you can use it tomorrow in whatever setting you're in to help them reduce their stress. Hey, I don't think we have any questions, Sharia. So if you just want to stop the recording, I think we're good. Thank you so much, everybody.